We are going to talk today about dementia care, the link between primary and secondary care in the MENA region. As you know, dementia is one of the biggest challenges facing the health and social care system today. And unfortunately, you cannot solve the problem of tomorrow using yesterday thinking. So we have to come with a new way of healthcare system, new network, new system in order to be able to handle demented patients. There are a large number of health and social care services that people with dementia and their carer need to access, including, among others, of course, the geriatricians, the physiotherapist, the practice nurse, the district nurse, the old age psychiatry, dentist, nurse, social worker, and other people as well. So the number of people involved in the care of demented patients is enormous, and therefore coordination is important. In order to reach equal access in dementia, it's important to achieve and maintain a diagnosis rate of at least 2/3 and to increase the number of people being diagnosed with dementia and starting treatment within 6 weeks of referral. There are a number of barriers to diagnosis, including, among others, poor recognition and understanding of symptoms, a reluctance to seek help or disclose symptoms due to stigma, poor understanding of the benefits of and need for timely diagnosis, and a reluctance in healthcare professionals to make a diagnosis. In order to improve quality of post-diagnostic treatment and support for people with dementia and their carer, it's important to improve the type of delivery that we give to our patients. And in the UK, for example, there has been an increased use of integrated delivery of care models involving primary care and other agencies. However, there is considerable local variation in the degree of this integration, even in the UK, and some GPs take a very active role in diagnosis and the initiation of treatment, but not all do this. Unfortunately, in the MENA region, the system is lacking. In some countries, there are some attempts. However, those attempts are meager and they do not fulfill the current need for demented patients. In order to deliver a good dementia care in the MENA region, we need to focus on preventing the disease first, to be able to diagnose early, supporting those who are diagnosed with dementia. Those who are diagnosed with dementia, with the support, we try to make them live as well as possible and eventually die in a good condition. When the patient is referred for an assessment for dementia, he will receive a timely diagnosis and reach an agreement on initial care plan. So in the initial visits, there need to be a good diagnosis and a good care plan. The patient should have a personal choice in decisions affecting his care and support, be able to jointly develop his care plan. It is vital that the patient knows that he will be supported well, he will be treated with dignity and respect through services that are designed around him and his needs, and that they will be appropriately staffed and staff will have the right level of training. The presence of a coordinator of care is important, that she make sure that the patient will get treatment and support which are best for his dementia and his life. In addition, the patient should know that those who are around him and looking after him are supportive. So we need to support the caregiver. This will include emotional, psychological, and social needs. Furthermore, it's important to make the demented patient included as a part of society. He needs to feel included as part of the society by helping him build relationships, be involved in his community, or engage in activities that she enjoys. At the end, the patient should be confident that his end of life wishes are respected and that he will expect a good death. There are a large number of models from the UK that are trying to look at different care pathways, and some of them are very useful and then can be integrated and can be used in the MENA region. And a good model includes something called dementia-friendly GP surgeries iSpace, whereby they try to make the GP surgeries, GP clinics more dementia-friendly, more appropriate to meet dementia cases and care. And thank you for listening.